let's start here, Commissioner John King. It is open enrollment right now, and you are on a little bit of a statewide tour talking about options for Georgians. So let's start there. Well, if you're a Georgian, you're trying to get on this exchange program, what do you need to know?
What you need to know is that you have an agency that's focused completely on giving you as many options as possible. Go to our site, go to one of our events across Georgia, and ask questions. Ask somebody that understands the coverage options that you have. Hey, am I covered for this? Am I covered for that? Individualize that choice of insurance, because obviously the rules have changed. The subsidies had a major impact on the rates, and so we want you to make the best choice possible. And the way to do it is by going and talking to one of our professionals who is there to. We don't work for insurance companies. I don't care what insurance policy you buy. We just want you to make the best choice possible.
You brought up the subsidies. Let's talk about that in a moment, but let's stay macro level here for now, because some folks may be hearing about Georgia Access. They may be also looking back in their minds and thinking, oh, well, I've heard about Georgia Pathways too. What's the difference between these programs?
Completely different programs. They're tied in well, but because we all operate in the state of Georgia. But Georgia Access is the private health insurance market. It's for folks who typically have a job, or they have enough means so they can buy their private health insurance coverage. I regulate the private insurance market. The Pathways is run by the Department of Community Health, and they do Medicare, Medicaid, regulations.
And I think you summed that up pretty clearly. Pathways is the state Medicaid program.
Yes.
Access is the private health insurance exchange. It's the state version of the Affordable Care Act exchange, right?
Yes.
Open enrollment, when did it start?
Started November 1.
And it runs until?
To January 15th. Now in Georgia, because this year was going to have so many changes, what we did is we opened what we call window shopping October 1st. So people could go and look at the plans available, not make a choice. So we gave them what we call window shopping, 30 days to window shop, and then November 1st we allow people to select the plan.
Let's talk about this, what we've been sort of swiping at for a little while in this conversation. Insurance has been at the front of the news in a big way over the last 5-6 weeks, and I see you nodding along. You look almost, I don't say shell-shocked, but you look like you've been thinking about this.
People are very discouraged. I am very concerned about the affordability of insurance, and we're working every day to try to give as many options as possible, working with carriers, holding their feet to the fire. To when they put a plan, on the marketplace, that plan is going to deliver what they promise. So I'm very concerned about affordability.
There's been a lot of conversation in Washington and elsewhere about the impact of these enhanced Affordable Care Act subsidies. They're set to expire at the end of the year. A nonprofit health news outlet, KFF, they estimated that marketplace premium payments would on average more than double if those subsidies are not extended. When you see data like that, does that worry you?
It worries me, but I don't just look at KFF as one of the sources of our information. We're looking at live market. We get to see what the rates are, what the utilization rate. And KFF sometimes they look at some of the factors, but I don't think they have as good view of the marketplace as we do.
What do you think the impact would be in Georgia if these subsidies are not extended for the average ratepayer?
It is an average depending on your choice of insurance, utilization. It's going to be about 23%.
An increase?
Yes.
That's substantial.
That's substantial. We're completely worried about, because what we're worried is that young, healthy people will decide to walk away from the marketplace and just go use emergency rooms, which we all end up paying the most expensive, most inefficient way of getting health care delivered.
And if those young, healthy people walk out of the system, does it also then push up the premiums for the people who remain enrolled?
It doesn't push the premiums this year, but it potentially has some negative effects down. And so our marketing strategy has been focused completely, really putting a lot of opportunities to go and engage a young, healthy cohort of consumers, of giving them more options to allow them to stay in the market. Maybe not go for a silver plan, maybe go for a bronze plan. And what we're doing is we're showing them, this is how much you used last year on your health care. You bought a silver plan, you probably could have gotten away with buying a bronze plan, and you could have been cheaper. And so we're trying to get as many options in front of them. And I think we're starting to see some early signs of people really taking the opportunity to talk to folks in the marketplace, and people who really know the utilization and what the market's.
This subsidy conversation, it's still ongoing. Obviously, the government shutdown. We're taping this interview on Thursday. It ended less than 24 hours ago on Wednesday. But the subsidy question was not resolved. The Senate says they're going to hold a vote on these subsidies in December. What happens in the House is an open question. Federal lawmakers, I'm sure, will be watching to hear what you say. They're going to hear your comments on this issue. Does Congress, in your view, have an obligation to extend these ACA subsidies?
I don't know if I'm torn, in all fairness, because I think about the people that don't have a lot of resources to buy insurance. I know the subsidies were put in as part of COVID. And so I realize that continuing to put a Band-Aid on a plan that a ship that's sinking is not a long-term solution. I'm interested in long-term solutions, and putting a Band-Aid on, let's just keep people for one more year. I don't think that's effective governing. I think I wish Congress would have done a permanent solution years ago instead of getting us up to the cliff. I'm just exhausted of the cliffs. I think most Georgians are exhausted of just going through crisis. Get us permanent solutions. That's why I've been a big advocate of taking away some of these authorities that we've ceded to the federal government and bringing it back to Georgia, so the Georgia legislature, so regulators like myself can actually focus on long-term solutions, because I think Georgians are exhausted and just we're tired of everybody pointing the finger at each other and blaming each other. This is not how government is supposed to work. And so the subsidies, it's a Band-Aid. I think we need to really look at this market and really redesign and come up with more options, so consumers have real choices. Not give me a little cracker that falls off the table so I can make it one more year. I don't think that's a just thing to do to Georgians.
You use the analogy of a Band-Aid in this conversation, noting that we're in the second week of November at this point. We're coming up on the end of the year, about 6 weeks away from the expiration of these ACA subsidies. If the subsidies are a Band-Aid in your view, should Congress just rip the Band-Aid off and let those subsidies expire?
In all fairness, that's what they've done already. I mean, this decision should have been made 3 months ago, because the market opened November 1st. I had to publish the rates October 1st. And so even if the subsidies come into place, I'll have to turn around and jump through our agency. We'll have to jump through all kinds of hoops. I will have to bring carriers to republish rates. This is not as simple as turning on a switch. Members of Congress think that they have to December 31st to take action. This action should have taken place 3 months ago. And I think it's time to really focus on how do we permanently fix this.
What would that look like?
I think it requires a redesign of how we approach healthcare delivery. How do we redesign? How do we provide products to the consumer to really be empowered to make choices, not just to get the worst? I mean, my police officers in Doraville, we had to choose. We had 3 choices. And it's like when you only give people a limited time to choose, they just go, well, give me what I did last year, or give me the silver plan because it's in the middle. I think consumers deserve a little bit more time to study what is their effect on their family, on their finances, so they can make the best choice. That's my frustration, and I know I'm the regulator. I'm supposed to be frustrated about this. But at the end of the day, I'm thinking of my police officers and the families that I had the privilege of leading at Doraville, to make the best choice possible. Not large insurance companies of being able to benefit, or large hospital systems who just they play each other. They play themselves against each other, and it's kind of exhausting.
You've used a couple phrases again and again here in this conversation. One of them was frustrated.
Yep.
Another one is pointing the blame at each other. Who do you blame for this? Do you blame both Republicans and Democrats?
Right now, I blame everybody. I think this is my pitch to the Georgia legislature: bring control back to our state, because we couldn't get away with this in Georgia. Our legislature, our governor, myself, we would never do this to Georgia consumers. The fact that we had soldiers not being paid and their families having to go to to soup, kitchens, or TSA agents that couldn't buy gas to go to work. To me, that to me is it's America's better than that. I think it's time for folks to grow up.
Do you think federal lawmakers will?
I'm an optimist. I'm a former Atlanta police officer. I think the sun will come out tomorrow. I just hope. I have good friends who are Congress members who are. I know that they're embarrassed about this. They know that this is not the way to lead our nation. And it's my hope that they get that they wake up and not do this to our nation again.
Commissioner, is there anything I missed that you think is important for somebody who is maybe exploring the Georgia Access Program right now?
I want to encourage Georgia consumers that there's no wrong door on getting coverage. Whether it's going to one of our events, calling our department, engaging Georgia Access via message, email, text. Go to one of our events. We're going to have a great event coming up at Greenbrier Mall this Saturday. We will have a ton of information out there. Music is a way to people to. We're going to go to the places where people are gathering so they can gather the information to make the best choice possible.
Commissioner John King, always appreciate it.
Thank you so much.